Hi everybody, my name's Stephen. I work for Terrence Higgins Trust. I'm a Lanarkshire Sexual Health Promotion Specialist. I'm here today with Billy Thomson and Jo Duffy. We're here doing just a 20-minute, 30-minute video on WorldAids Day, talking about different things revolving around HIV, but services that are in Lanarkshire, personal experience, and anything else that's kind of around that subject. So I'll pass it over to whoever's next on my screen. I've got Billy.
Thank you, Stephen. I'm Billy, as Stephen says. I currently work at THT also, Terrence Higgins Trust here in Scotland, based in the Glasgow office, and I'm part of a project called Peer Support Scotland. There we support people living with HIV, whether it be like housing needs or general health needs. And through COVID and lockdowns, we've been doing like general check-ins, making sure that everybody's okay. We've basically been isolated and having someone to talk to, someone they can, get in touch with and pass anything back and forward to that they need any information on. But just keeping a check on everybody's well-being. Also, I'm someone that's living with HIV, and as this is dedicated to WorldAids Day here in 2021, it's a case of I'm here to give a knowledge of what it's like living with HIV. And as time goes on, where my journey was, where I am now, and now from being someone who came into the services to begin with, then moved on to working within that service.
Brilliant. Thanks, Billy. Then over to Jo.
Hi there, my name is Jo Duffy. I'm Senior Health Promotion Officer with NHS Lanarkshire, and part of my role is managing the Lanarkshire CDS, which is the condom distribution scheme. So I'm part of the BBV and Sexual Health Network in Lanarkshire, and we look a lot at sort of prevention activities, so distributing condoms widely, just to help prevent sort of sexual transmission.
Brilliant. Thanks, Jo. Yeah, so we're coming together a day to talk about WorldAids Day and HIV. We're wanting to, just to throw open, really, just to kind of what was kind of our first experience of HIV. I'll just start because I'm gay, and it's been part of sexual health has been part of being gay for quite a long time, and that's kind of been my first experience of it when I first moved onto the scene, enjoying myself. And I think it was actually I went to the toilet and there was like a poster up about HIV testing, and I remember reading it, and it just stayed in my mind. It was something that's kind of always been there, and there's like it's kind of been part of being on the scene and being gay. Sexual health has always kind of been there. So that's kind of how I first got introduced to it, apart from like what I heard in the media and what I heard in through friends and family or whatever. But my first kind of experience with it I think it was the Polo Lounge in Glasgow. And I remember kind of looking at it in the toilet and being like, right, okay, and questioning and wanting to kind of know a bit more. And then that kind of led me into doing a bit of volunteer work for Gay Men's Health. It was on Bell Street, and then I started working in the pharmacy and still talking about it a little bit, doing some condom distribution, and now working for Terrence Higgins and going about different places, schools, colleges, really anywhere that will take me, talking about HIV, getting the awareness up, letting people know about the new ways of testing for HIV, the new drugs that are available for people that are living with HIV, and as well as other drugs that are for people who don't have HIV that can help prevent it. So, and this is what the day is about, just to kind of advertise what it is that THT do within Lanarkshire, and to just help promote the services, help promote the clinic that I run, because I'm going to be plugging that. I'm just going to have to say it. I'm going to be plugging that quite a bit. So I run a clinic every Thursday. Everyone's welcome. It's appointment only. The information will be in the YouTube page that this video is going to be on. If you want to call up and get an appointment, it's every Thursday from 4 o'clock, 4:30 to 7 o'clock, and we'll test for HIV, syphilis, Hep C, chlamydia and gonorrhea. So it's a kind of full sexual health checkup. And it's getting quite busy at the moment, which is great. It's always good to see people using sexual health services. So again, this is what this little video is about, kind of what it is that we do here at Terrence Higgins and at the sexual health team at NHS Lanarkshire. So I'll kind of ask the same question to you guys. So Jo, what's your kind of first experience with HIV?
So I think for me, before I started in the role, I had never really had any experience of working in sexual health in this field at all. I probably couldn't have told you what a bloodborne virus was. I think I had a sort of rough understanding of what HIV was, but I always get slagged in the team as being the young one. So I was probably born just after the sort of tombstone, that horrible advertising came out. So I suppose I was never really clouded by that. So I think it astounds me now that there is still so much stigma and stuff surrounding HIV and people living with HIV. So I kind of make that my mission as well to be a big part of what we do within the team. I would class myself as an ally. I would always, wear my ribbon, talk to people about it as much as possible, just try and dispel the myths because they definitely are still around. But I think the good thing is, younger people coming through, we're a much more accepting sort of generation, I would say. People are a lot more open, a lot more willing to have conversations and listen to what's going on. So, yeah, it's probably been in the last 5 years that I've started working in this role specifically. So, yeah, it's been great.
Brilliant. Yeah, it's kind of interesting to look back at where you were in terms of your understanding of HIV to where it is now within kind of working in sexual health, and then comparing that to how other people view HIV. And there is marked differences, like you mentioned. There's still stigma, but this is what this is for today, WorldAids Day, to get people to kind of talk about it, to understand it in a different way without a lot of fear. Like the tombstone advert that you mentioned there, how that's still in society. People still think about HIV and that advert and how it brings a lot of fear. So it's great that we can talk about it in an open forum, talk about it with people openly, and make people feel comfortable in their understanding of it. And I'll ask the same question to you, Billy. Like, what's your first experience with HIV?
Well, it's strange really, because obviously earlier on this year we had It's a Sin, and that caused quite a big scope for folk to bring HIV to the fore again. All these discussions were happening and folk were getting involved in that. Because I was even approached to do a bit for one of the online newspaper things, Glasgow Live, which I did a report, because I ran about the town in the 80s when this was happening. I was working in 1975. So, and being a gay man, I was at these clubs and we lost friends through it, and we had a different kind of lifestyle to what we've got now, because it did curtail us in a way. You know what I mean? Our freedom was taken away from us at that point. And like everybody says, and Jo, you have alluded to yourself in other conversations that we've had, the fact that it's still predominantly seen as a gay disease. And it's quite hard when you look at it that way, when I know now working in the field, that it's a crossover. So if you were taking certain communities, you'll understand why the numbers happen the way that they happen. But myself personally, I was diagnosed HIV positive at 13 minutes past 1 on the 1st of September 2009. And it's like a life-changing event, whether you're having a baby or you lose someone close to you. You remember certain things. More so, I remember that consultant at the time, the room, the feeling of the room, the colour of the room, and the whole sort of ambience of what was going on. And then hearing those words, Mr. Thomson, sorry to call you back today, but I have to tell you that your results came back and you're HIV positive. So all my stuff has been done through the Lanarkshire end. And on that, but it's a 2-minute wonder, to be honest with you, because like he told me the news, then it was a case like I've been in touch with my colleagues at Monklands Hospital, and somebody will be in touch with me for the next 2 or 3 weeks. So that was it, hung in the balance, left, went for a bus and up the road. That was it. I mean, and from that, that's when I sort of got a wee bit more proactive in that sort of stuff, because I thought there should be someone there to give you advice, or there should be a package of some sort. you know, to let you know, call this number should you need or whatever. But to sit in limbo for about 2 or 3 weeks was one of those ones I'm thinking, right, okay, fine. But eventually I did go to Monklands. I was a late diagnosis, so I'm going to put that up, which is really something to take note of, because I say about testing. If you basically think you put yourself at risk, get tested as soon as possible. I was a late diagnosis, and if you know anything about viral loads and CD4 counts, basically I had no immune system by the time I got there, because my CD4 at the hospital was only 12. By the time I got to Monklands was only 4. So at that point, even the consultant had to phone down for the results in that morning. And my sister was with me in the room, and it was just a strange thing. She went, oh dear, right, okay. And then I never got home. I was in the ward. You know what I mean? So my first experience going to the hospital, I was in the ward. So that was it. But that was my first run in HIV. And as I say, it's 12 years on, still here. Given at one point we'd been in the hospital with double pneumonia, and that the next 48 hours would be crucial, that if I didn't turn around there, they could lose me. So that was it. But I'm here to tell the tale and work through this stuff as well.
Yeah, and it's great that you feel comfortable to talk about it. So thanks for that. Thanks for coming on to kind of talk about your personal story, because that's what people, there's only kind of so much that I can do as someone who's training. But when you hear it from like a bit of lived experience, it connects people. And you mentioned like the late diagnosis, and could you go into a little bit more of that? Of like, is there a reason why it was a late diagnosis?
Well, the reason was before, like, I had never thought, right, obviously being a gay man, like I said earlier on, I always used to get tested, and you'll be aware of it, the Steve Ritson project. So I always used to get tested there, and I used to go yearly for it. One particular year I didn't go, only due to the fact, so like, and just to put a wee bit of humour into it, I had a quiet year, so I thought I don't really need to go, don't feel I put myself at risk, this whole scenario thing. But then I took strange wee things going wrong with me after, you know, a year or so. I started losing weight, but that came through. We did something, and I worked in retail at the time. This is the humour side as well. And I worked for this crowd of girls who wanted to lose weight. But they'd read a magazine about Beyonce saying that if you take pineapple juice in the morning, it speeds up your metabolism and you lose weight quicker. So being the manager, like, I'll encourage you, I'll join in with you. So the whole strange thing with that was, it was a case of, they got their pineapple juice every morning. I set them up, we do it. And as the months went on, the girls were going, this isn't working, because it's working for you, Billy. And I thought nothing of it, because you're never aware of your own weight loss as time goes on. You know what lose weight, but you don't see yourself differently. And then all of a sudden, one of the delivery guys came in and said to me, Billy, whatever diet you're on, please stop. So I hadn't realised, but then I started getting niggly sounds going wrong with me. So I started attending the hospital. They thought it was an ulcer, so they were treating me for an ulcer. So I thought, at this point, I've lost 4 stone. Quite easily lost 4 stone. I was buying stuff from shops extra small. You know what I mean? It's that whole thing. I had to go and search places. In those days, I'm going back to 2009. The only place I could find things was Top Man. They were the only ones that did small sizes for guys. I'd only been a wee petite thing myself, you know what I mean? It's that whole thing. Only at 5 foot, these were just the ideal size for me. No body fat on the body. You achieved the body you always wanted, but not realising that it was HIV that was causing it. But because of the late diagnosis, it then causes other problems. As you weaken the heart, you weaken other systems and stuff like that. So from that, I've come away with having other conditions that go along with it. But that's something I've got to manage along with HIV.
Yeah, your late diagnosis is something that I talk about quite a bit to make sure that people are still aware that it can happen. There's a lot of different reasons of why people can get a late diagnosis. And a lot of the services that are available for people that have got a late diagnosis, it's something that when people are more aware of it, they feel comfortable to go and get tested. And Jo, is there what kind of services that are available in Lanarkshire from anyone who's just wanting to kind of start their kind of understanding of their sexual health to someone maybe feeling that something's wrong with them? Or
Yeah, sure. So I think I'd said right at the start that we're all part of the Lanarkshire BBV network. So it's a great sort of partnership network approach that we've got in Lanarkshire. So we've got sort of clinical and non-clinical NHS staff in there, as well as loads of third sector partners. So like say yourself, Stephen from THT. We've got reps from Waverley Care as well, because there's an African project and a Chinese project within Lanarkshire. So we're really lucky to have both. And we've also got the likes of We Are With You. So we've got loads of different supports in place. What I would say is, I think, Stephen, you're going to put on the end of the YouTube video some links to the Lanarkshire Sexual Health website and also the Lanarkshire HIV and Hepatitis website. So we've got the list on there. I won't give you all like sort of web addresses and phone numbers and stuff. Everything is within the Lanarkshire Sexual Health website. But I think the main kind of topics that we look at within the network are prevention. So that's probably where I come in more. So the sort of free condom service across Lanarkshire, we look at prevention activities just to help stop people becoming infected with HIV in the first place. Then we've got loads of testing opportunities as well. So I know, Stephen, you're definitely plugging your testing clinic. But we've also got sort of Lanarkshire have lots of sexual health clinics as well, where you can get testing done, and there's loads of opportunities to get testing done more ad hoc as well, and different services can offer different things. We've got a really good treatment centre that Billy obviously touched on as well, which is based at Monklands Hospital. And we do lots of other work as well, just around sort of training and support and care. So there's loads of services available, and what I would say is, if you're not sure where to go, no matter who you sort of phone or what service you phone on the website, then somebody would be able to point you to the best sort of place for you to go.
Mm-hmm. Brilliant. And you mentioned the Chinese service and the Black African services. Is there any more you can talk about that?
Yeah, so we've got Nathan and we've got Benny specifically, so they work within those projects. So Waverley Care is a great organisation, and we are really lucky to have a couple of reps within Lanarkshire. So they do sort of like one-to-one work with service users. They'll do group work sessions as well. They do loads of sort of outreach work within the community. And I know Benny's done some work recently getting some sort of Chinese specific information and stuff on the website, because at a really basic level, if you're looking at a website and you can't actually, it's not in your sort of first language and you can't understand what it says, then how are you going to be able to get into the right services? So Waverley Care are great. They also distribute condoms for us as well, just like sort of specifically around their communities, and they can offer testing opportunities as well.
Brilliant. Yeah, it's good to know that there's different services for different communities, because communities look at HIV in different ways, comparing like the GB MSM community, so gay, bisexual men who have sex with men community, compared to maybe the Chinese community would look at it a bit differently. So it's great that there's different services that are catered specifically for who's needing it. And it's for anyone who's GB MSM within Lanarkshire can contact us, Terrence Higgins, and we can send out condoms, so by post. It's called Get Rubbered. It's every 2 months that you would get whatever it is that you're asking for, condoms and lube, sent out to your home address. And it's the uptake has decreased a little over because of COVID, but there's a lot more people. There's still a lot of envelopes being sent out because I have to do a lot of the packing. But it's another great service that's offered in Lanarkshire, and especially with GB MSM community that might feel a bit uncomfortable going in to pharmacies where the C card is available. They can just get it. It's a little bit more anonymous, and they feel a bit more comfortable kind of using that service. So that's another thing that's happening in Lanarkshire, which is great. And obviously the clinic that I'm going to keep plugging, but we also have a postal service as well for HIV test kits. It's on our website, tht.org.uk, and you just put in your postcode. If it's a Lanarkshire postcode, you'll get it sent out free, delivered to your house in a kind of grey box. It's a nondescript box, so you won't know what's in it. So if it comes to your house and they're living with flatmates or family or whatever, they won't see what it is. But if you're living outside the Lanarkshire area, then our kind of system will put you to the service where you can get it for free. HIV Scotland's one of them, where you can get an HIV test kit sent out anywhere else in Scotland, but for Lanarkshire, we've got the specific one for Terrence Higgins. But we work, we definitely liaison with HIV Scotland to make sure that people are getting HIV test kits wherever they're needed. And it's something that's really what this kind of video is about, to get the information out there, to kind of talk about it. And Billy, could you kind of talk about what it's like to kind of be part of Peer Support Scotland, what the groups are like, what's your experience been with service users, what will they experience as using the information or the service that we might provide or that you'll provide?
Well, that's the joyful thing about being part of something that I'm now giving back, because before I became employed at THT, I was a sessional worker, but before that I came in as a volunteer, but also started off as a service user. So having done the gamut, I know the process now. I know everything behind everything. And one point I'm going to highlight, as Jo said earlier on about doing within Lanarkshire, the other communities, the Black community and obviously the Chinese community. That's another thing that's important for people to realise, that we do have people there who can step up and help them out more than anything else. Because ourselves within Peer Support Scotland, we've got service users we use as peers, so therefore they come and help out elsewhere. For myself, I started as a peer. Going forward, I'm giving advice out, doing talks, listening to folk. But again, I attended men's groups to begin with as someone who felt that I needed that to bring myself out. Being newly diagnosed, I've got this saying that I was too ill at the beginning to be a late diagnosis, that the fact I lost my voice for 3 years and everybody else was speaking for me, making my decisions. And this person seen that I needed to come forward, and they kept pushing to take me to a men's group, went to the men's group. That was an insight, because at that point, it's like anything in life, you think you're the only one, then you walk in there, and it was like one of those things, but it just blows your mind. You realise all of a sudden you're not just the only one. But then people that know me now know that I like to talk. Those days, I was the wee guy at the back being silent. I was just observing everything, taking it in, until I realised the penny dropped. There's more like me. That's the main thing more than anything else. But when it comes to, using the services within Lanarkshire, I've had great support, from Monklands Hospital, from the nurses there, from consultants there. Anything that's gone wrong, they're on the case, and that's it. And no matter what happens, I'll be honest with you, myself personally, they go like, so what are we going to do about it? My line to my consultant is, look, you got me through the last time, so I'll put myself in your hands, tell me what I need to do, and I'll take that through. So that's the sort of knowledge and basically I take into Peer Support Scotland, because I'm one of these people, when I'm dealing with service users, you do get some people, and don't get me wrong, because people will use this as a journey to move on. I mean, I know personally I've become a stronger person at the end of the day, and I quite like who I am. You know what I mean? It's made me somebody that I'm happy with. Mm-hmm. But you've got other people who wear their HIV like a badge, and it's a case, woe is me. And it's encouraging them to go forward. And I'm one of these people, if I can do it, you can do it. Mm-hmm. Simple as that, because I'm nothing special. I'm just a wee guy living with HIV, going day to day, doing what he normally does, and having a normal life. Mm-hmm. I love people. People are important. Therefore, when certain people are struggling with it, it's just getting them on that right path and getting them to move forward and to show that there's someone there. And again, when you've got other communities, because again, working within Peer Support Scotland, I've had the opportunity to actually deliver a 3-part workshop to an African and Caribbean community, having to learn how we're going to present it, having to change the language so they understand it. So the work's there, the work's being done. So if you're from another community of any sort, feel free to come forward, whether it be the Lanarkshire services or whether it be through THT in Glasgow. There'll be someone there to help you. Because I'm dealing with a Brazilian guy at the moment, speaks Portuguese. We have a peer who comes from Portugal, helps with translation. Excellent, you know what I mean? So there's always something there to help somebody out.
Yeah, it sounds, well, I know the work that happens in Peer Support Scotland and how helpful it is to people living with HIV. And like you said, getting people to come out of themselves, because when people do get diagnosed, they can go the way you described it in themselves. And the services that are available are a great way to kind of build resilience within the person. So it's not just.
And that's the main word, Stephen. That is the main word, resilience, because like, we deliver workshops, skill development workshops, and it's all about making them feel better about themselves, giving them a path forward. Because sometimes you're not aware of how far you've come until someone points it out to you. Hence the reason why we're doing a workshop called Tea and Vitality, which is a 3-stage one. It deals with your diagnosis, it deals with where you're at the present, and then you look to the future, what's in place for you moving on, whether as you're growing older with HIV and what's in place for you there. So again, that's something that, you know, peers and service users come in to do this workshop, and it's learning. Sometimes they're not aware that they might think they're still stuck, but no, they've achieved a lot from that diagnosis to where they are today, no matter how many years they've been living with HIV.
Yeah, I think it's it does. It just kind of pulls people out. That's been my experience when dealing with working with people who are living with HIV, who have been maybe newly diagnosed, or it's within the past few years, and they're feeling a bit lost, unsure about themselves. And but the services are great to kind of it's about getting people into them. I think that's once people are into the services, then it's great. The work there can really make them feel good about themselves, and as I mentioned, build resilience. And that's what WorldAids Day is about. Like WorldAids Day is about to make sure that it's still on the agenda. It's not something that's disappeared, even within like the GB MSM community, because it's not on the forefront anymore. There's not people that are dying within the community because of things like PrEP, which like you're taking it with the pill once a day, and you're not you can't catch HIV, you can't pass it on to anyone if you're going to be on the different kinds of medication. So it's treatment is prevention. So people who are on these meds, it brings the viral load down to a point where it's called undetectable. If it's undetectable, then it means it's untransmittable. So getting people to be aware of this makes people who are living with HIV feel a bit more comfortable. But it's not just about people who are living with HIV, it's about people who are not living with it. Because once you get that information to them, then it just makes it a lot more easier for everyone to kind of understand it. And I know that WorldAids Day is something that it's usually quite a big event, but obviously because of COVID, it's a bit smaller, but it's still just as important. So is there, Jo, what's happened in the previous years within Lanarkshire for WorldAids Day?
So we've done lots of work previously with the colleges. I know, Stephen, you've been involved in that as well. So just going out, doing events within like the local colleges, letting the younger generations know like what it's all about. But this year we're still flying the flag. So North and South Lanarkshire Council are always really great at flying the red ribbon flag for us, which is just a great show of kind of solidarity. And we've got places lighting up red as well. Around about WorldAids Day, and we just send out loads and loads of information. We bombard people basically, we make them take notice of us and what we've got to say. So just through like our staff briefing, our social media accounts, through like our email distribution list as well, and we've got like email auto signatures. And what I've said this year is, just be that person, be that ally for somebody. If you've just got that on the end of your email, then it just shows that you care and that you've got something to say about it. So yeah, we're just pushing the message as far as we can.
Yeah, brilliant. And you mentioned ally there. Could you explain to if anybody's watching, they don't know what that means?
Yeah, and I think it's the National AIDS Trust this year that are doing a really good campaign actually, called Rock the Ribbon, and they've got some celebrities as well as part of the campaign. So you've got people that are living with HIV and people who aren't, but they're all wearing the red ribbon. And it's just to show, that you've got a wee bit of knowledge, a wee bit of understanding about it, and you're there shoulder to shoulder with people who are living with or otherwise affected by HIV. Because I think we said right at the start, we spoke that there is still stigma out there when it comes to HIV. So even if you're somebody who's not living with it, if you can just sort of show that support, then it's greatly appreciated.
Yeah, definitely. I think it's just the wee ribbon. It says a lot for people who are living with HIV. It makes people like you say, feel comfortable, because there is still the stigma. But that's how I've got a job. That's what it is, because there's still myths that are going around about HIV, about how you can catch it from someone, about holding their hand or like kissing them, or
Kissing.
yeah. So there's a few myths that are still out there that we're still trying to get round, and just wearing this ribbon kind of shows people without actually showing, because it's not really in your face. It's there, you can notice it. And I think that's all it is to be an ally. It's just about noticing. It's not about putting it in anyone's face. It's not about trying to give information to people that maybe don't really want the information, or they're not ready for the information. It's just about showing that there's a little bit of solidarity on the peripheral. And more often than not, that's all that it takes for people living with HIV to feel more comfortable with themselves, and as well for people who are not living with HIV to go and use the services that are in Lanarkshire, like the testing, like this, like engaging with Terrence Higgins, or engaging with Lanarkshire Sexual Health. So that's all this little ribbon can talk about, and when people see it, even though it's just like a little bit of ribbon, but it does mean a lot to people. And so it's good that we're talking about WorldAids Day again, and I do like this format, this kind of what is it, the Brady Bunch format? Quite like, but it's quite good. And it's only a quick video, 20-30 minutes, so we're coming to the end of our time. Is there anything that you guys want to say about your services, or something that you guys just want to say in general about WorldAids Day?
I think Billy made a good point actually about the sort of life course now of HIV, because we are really having to start to think now it is a sort of manageable long-term condition when you're on like the effective treatment which there is available for people. And probably before, we didn't have to think about people getting older and living with HIV, because it just wasn't really happening. So it shows you how far we've come, and it's great that people like Billy are here and they're, you know, happy to share their story and linking in with people and just allowing them to take that journey. So well done, Billy.
Yeah.
Thank you. And it's strange though, because like with Stephen talking about the clinics, now the fact that it's European Testing Week this week, the first clinic started in Scotland on European Testing Week, when they did a trial run. It was for 3 nights to see how it would go, and I was in there doing the reception at the time, and we'd all different people from THT coming in. You know, the management came in, as well as, you know, the people that worked within the Lanarkshire end coming in and doing a night there within it. And the fact also, we're at 40 years of the first person, you know, basically diagnosed and dying from, you know, as they would say then, AIDS. But as we know, it's HIV the killer, AIDS is the virus. But more so than anything else, it's tying them together. And like we started off at the very beginning where I'd mentioned it's a sin, and it brings it full circle again. And we Jo mentioned regarding the tombstone thing and not being old enough to really be affected by it. It's the older generation that remember that. But my main thing through the years, WorldAids Day, having done so many different events, is that no matter what stage I'm at in life, my main thing on a day like today for WorldAids Day is to tip my hat to those that went before us, because without them, we wouldn't be where we are today. So that's my part message on that one.
Yeah, definitely. It's so true. That's what WorldAids Day is about, remembering, making sure that people aren't forgotten the work that they've done. And it's really, I feel good to talk about it. I do. I always, when like WorldAids Day, there's a lot of work involved behind the scenes with this day. It can get really stressful, but when we're talking about it like this, like the three of us are talking about it, it just feels nice to talk about it. It feels good that I'm actually doing something, and we're actually doing something to help people that are maybe feeling uncomfortable about themselves, about maybe feeling uncomfortable about the virus, how it can induce shame, how it can be traumatic for people. But remembering the people that have, like Billy said, like came before us, and the work that's happened and the work that's happening now to make people feel comfortable. It's great to kind of be part of that, and as well to kind of hit home that there is effective treatment now, that you can't pass it on when you're on effective treatment. You can go on PrEP and take the pill once a day, and it stops you from contracting the virus. There's PEP. So if an accident happens, if a condom breaks, then you can go to accident emergency and get this course of drugs where it stops the body absorbing HIV. So there's so much now that there is to help prevent the to help make the spread of the virus, to stop it, sorry, compared to what it was like living in the late 70s and 80s, of what it was like to be in that time where friends were just passing away in front of your eyes. Stigma, discrimination was rife about gay men because people thought it was a predominantly gay disease or a gay virus. And it's good to remember that, because now we can focus on where we are now. It's not to kind of dwell on it too much, to look at it, but to look at how far we've come from it. So it's great we can talk about that. So I'm pleased that we've had a wee discussion about it, and I hope whoever's watched have enjoyed it as well. All the information that we've talked about in terms of the testing that's available and services that are available in Lanarkshire will be tagged on the links underneath this video. So please have a look. If there's any kind of questions, I'll leave my details as well. But just to thank whoever's watched, and as well thanks for Billy and Jo for their time today, and I'll say cheerio. Cheerio.
Bye.
Bye.